Hi, I'm Dr. Seema Sharma and I'm founder director of Srishti Femcare. And today, by means of this video, I want to talk to you about how do you keep yourself safe from a doctor's clinic and hospitals in these COVID times. The reason why I made this video is because a lot of my patients are actually very fearful of visiting a doctor and going to a healthcare facility, and the fear is justified because hospitals usually see a lot of footfall of people of all kinds, and it is not possible to test everybody for what infection they are harboring. So they are actually hotspots, and we need to understand the few steps that we can all take to safeguard our health in when we are going to see a doctor or in the healthcare facility. Now, the first thing that I want to emphasize on is clinic visits are not leisure visits. So please do not carry with you unnecessary people. By unnecessary people, I mean, your moms, your mother-in-laws, your children. Some people even carry brothers' children. That's not justified. Even if it is not a COVID time or if it is some other normal time, as we used to see earlier. But then, hospitals generally would have a higher share of infections as compared to any other place. So please do not bring vulnerable age groups to clinics or hospitals. They are not only putting themselves in distress because they are more at risk, but they are also putting the healthcare workers at higher risk because they can themselves be having comorbid conditions and difficult strains of infections which are difficult to treat. So minimize visits and minimize the number of people that you carry to clinics when you go and see a doctor. Second thing is, you must write down your complaints when you see a doctor. A lot of times I see in my own clinic that, you are going to see a gynecologist. So I am definitely going to ask you about when was your last period or what was the complaint, if you see a breast lump, for how long the lump. So when you start fumbling about common questions, which is acceptable, that's not a problem, but it would be nicer if you were ready with these answers. So I'm going to ask you about last period. So that's not really the time you start fumbling and take 2 minutes to fumble and open up your app and, well, this was the time I had my last period. So common sense questions, if you can't figure out the questions, it's fine, but try and imagine if you are going with heavy periods or you're going with you didn't have a period in time, the next question will be, when was your last period? So at least be ready with those answers. And also write down all your questions so you don't forget. I always tell my patients that, write down all questions, because the moment they leave a doctor's chamber, then they come back the next minute when the previous patient is still sitting or the patient is exiting. That's, oh, doctor, I forgot to ask you this. So once in a while it's fine, but I see it far too common, and almost every second person does this. So try and write down your complaints so you minimize your interaction time in the doctor's chamber. So you keep your doctor safe and you are safe. Also, wear masks all the time. And please ensure that your mask is fitting well, because when you are wearing a mask, when you would be, it's loose, it's slipping down, your nose is not covered and it is still here, you are wearing it, it is just kind of loosely fit, that's not going to work. And sometimes, especially in pregnancy, people feel very breathless when they're wearing a mask, and the moment they come into a doctor's chamber, they will just remove their mask. Oh, I can't breathe. So, well, while you were sitting outside, you were wearing it, but when you come in close contact with the doctor, you remove it. That's not fair and that's not justified, because it exposes you to the doctor's saliva, because it's a common fact that anybody who talks generates a little bit of saliva and aerosols. So you are exposing yourself, your mouth is uncovered, your nose is uncovered, so, and the doctor is getting exposed to your aerosol. So both people are at risk. So keep wearing good masks, at least for the 5 minutes that you're inside the doctor's chamber. Also, be a little conscious about distancing. Is another thing I want to really emphasize, because though we keep hearing it all the time on TVs and every social distancing, but it hasn't sunk in, while you are, say, sitting for giving a blood test, your husband is standing next to you. Why is he standing? Why can't he be a little behind? What is the rationale of holding hands while somebody is giving a blood test? I mean, these kind of things, I think, little bit one should be concerned about. because COVID sometimes can be a deadly infection. And in pregnancy and certain conditions, when there is an immunocompromised state, you are more likely to develop. Your husband may not catch it, but you may catch it. So you need to be careful. So, don't enter places where already people are sitting. So just maintain your appointment time, stick to it, because in India we are still not very careful about the times that we maintain. We would just, somebody will say come at 9, coming at 9:30, we accept that is fine with everybody, but really it's not fine, because then the patient who had to come at 9:30 is already sitting there. And then you come at 9:30 and then you feel okay, no, patient doctor has to see me earlier because I had an earlier appointment. Stick to time. It helps everybody, saves everybody's times, and it helps to reduce your clinic time and unpleasantness. And as I said, minimize your contact time with the healthcare staff. Leave the clinic premises as soon as your consultation is done. So if you're two people for your consultation, one of them can collect the medicines, the other one can pay on the reception. So as a team, you just leave the clinic as soon as possible. Opt for online consultations wherever it is feasible. You could have a teleconsultation, you could have a phone consultation, whatever works. But minimize the face-to-face contact time with healthcare staff is going to keep everybody safer. Well, that's about it. Thank you so much for patient hearing. Bye.